Hello, this is Dr. Reena Rani Ray from Department of Biotechnology, Maulana Abul Kalam Azad University of Technology, West Bengal. The topic of today's discussion is in vitro fertilization or IVF. In vitro fertilization is a process by which an egg is fertilized by sperm outside the body. It's a major treatment for infertility when other methods of assisted reproductive technology have failed. The term in vitro is used to refer to any biological procedure that is performed outside the organism, in contrast to in vivo procedure where the tissue remains inside the living organism within which it is normally found. The process involves monitoring and stimulating a woman's ovulatory process, removing ovum or ova from the woman's ovaries, and letting the sperm fertilize them in a fluid medium in a lab. The fertilized egg or zygote is cultured for 2 to 6 days in a growth medium, and then transferred to the mother's uterus with the intention of establishing a successful pregnancy. The first successful birth of a test tube baby, Lee Brown, occurred in 1978. Lee Brown was born as a result of natural cycle IVF where no stimulation was made. Robert G. Edwards, the physiologist who developed the treatment, was awarded the Nobel Prize in Physiology or Medicine in 2010. In India, Dr. Subhash Mukhopadhyay was the first Indian doctor who successfully implemented the technique of IVF and helped in the birth of Durga or Kanupriya Agarwal. She was born in October 3, 1978. But unfortunately, the contribution of Dr. Subhash Mukhopadhyay was not appreciated at that time. IVF may be used to overcome female infertility in the woman due to problems of the fallopian tube, making fertilization in vivo difficult. It may also assist in male infertility, that is, defect in sperm quality, difficulty in egg penetration, low number of sperms, etc., by intracytoplasmic sperm injection or ICSI, where a sperm cell is injected directly into the egg cell. Now let's have a quick look on the requirements for IVF. So for IVF to be successful, it typically requires a healthy ovum, sperm that can fertilize, a uterus that can maintain a pregnancy. Due to the cost of the procedure, IVF is generally attempted only after less expensive options have failed. IVF is actually a 5-step procedure. It includes collecting the contents from a woman's fallopian tubes or uterus after natural ovulation, mixing it with semen, and reinserting it into the uterus. Additional techniques that are routinely used in IVF are ovarian hyperstimulation to retrieve multiple eggs. Second, ultrasound-guided transvaginal oocyte retrieval directly from the ovaries. And third, the egg and sperm penetration. And finally, the culture and selection of resultant embryos before embryo transfer back into the uterus. Egg retrieval. The eggs are retrieved from the patient using transvaginal oocyte retrieval, involving an ultrasound-guided needle piercing the vaginal wall to reach the ovaries. Through this needle, follicles can be aspirated and the follicular fluid is collected to identify ova. It's common to remove 10 to 30 eggs within 20 to 40 minutes. Now, egg and sperm preparation must be done in the laboratory. The identified eggs are stripped off surrounding cells and prepared for fertilization. And oocyte selection may be performed prior to fertilization to select eggs with optimal chances of successful pregnancy. In the meantime, semen is prepared for fertilization by removing inactive cells and seminal fluid in a process called sperm washing. If sperm is being provided by a sperm donor, it will usually have been prepared for treatment before being frozen and quarantined, and it will be thought ready for use. Now the co-incubation of sperm and egg. The sperm and the egg are incubated together at the ratio of about 75,000:1 in a culture media in order for the actual fertilization to take place. It takes place preferably for 1 to 4 hours. In most cases, the egg will be fertilized during co-incubation and will show 2 pronuclei. In certain situations, such as low sperm count or motility, a single sperm may be injected directly into the cell of egg using intracytoplasmic sperm injection or ICSI. The fertilized egg is passed to a special growth medium and left for about 48 hours until the egg consists of 6 to 8 cells. Embryos are cultured until having reached the 6 to 8 cell stage 3 days after retrieval. There are grading methods to judge oocyte and embryo quality. In order to optimize pregnancy rates, it is found that a morphological scoring system is the best strategy for the selection of embryos. Since 2009, the first time-lapse microscopy system for IVF was approved for clinical use. Since then, morphokinetic scoring systems has shown to improve the pregnancy rates further. So this is the time-lapse micrograph from 19th hour to 114th hour of embryo development. Now elective single embryo transfer, that is ESET, is being used. That is the technique of selecting only one embryo to transfer to the woman. Embryo transfer. Embryos are screened based on the amount of cells, evenness of growth, and degree of fragmentation. The number to be transferred depends on the number available, the age of the woman, and other health and diagnostic factors. In various countries, a maximum of 2 embryos are transferred except in unusual circumstances. The embryos judged to be the best are transferred to the patient's uterus through a thin plastic catheter which goes through her vagina and cervix. Several embryos may be passed into the uterus to improve chances of implantation and pregnancy. So this is the USG of the embryo implanted into the endometrium of the mother. And this is the summary of the IVF process, right from embryo retrieval, worm retrieval to embryo implantation. Success rate of implantation is dependent on some hormones even. They are progesterone, progestins, and GnRH agonists. Success or failure factors are, first of all, maternal age. The optimal age of the mother should be within 23 to 39 years at the time of treatment. Duration of infertility or subfertility, follicle stimulating hormone, and number of oocytes, all reflecting ovarian function. And finally, stress. Scientists found no significant correlation between psychological stress and IVF outcome. Some factors are there for opposing successful IVF. First of all is lower count of antral cells, Mullerian hormone levels, poor semen quality or sperm health, quality and number of embryos transferred, autoimmune disease of the mother, advanced maternal age, tobacco smoking and alcohol consumption by the mother, maternal health, that is obesity, diabetes, hypertension, and thromboembolism in mother. So this is all about IVF and the factors regulating IVF. So thank you. Thank you for patient hearing.